Well, hello, everyone. My name is Chuck Ingoglia, and I'm the president and CEO of the National Council for Behavioral Health. And I'm so proud to represent over 3,400 organizations around the country that deliver critical mental health and addiction treatment, prevention, and recovery services. I'm so glad to be with you today for this conference. And like everything, it's virtual. So the last few months have really challenged us as a nation, haven't they? I think we've all had to adjust how we work, how we live, how we relate to one another. So disruption has been the name of the game. I'm here speaking with you from the perspective of safety net behavioral health organizations. And I can assure you that the disruption felt within that industry has been just as profound, I don't know if more so, than every other part of healthcare. Our members have been severely impacted by the changes that have occurred in the way services are delivered. We last did a survey in April to try to understand what exactly was happening in community behavioral healthcare. And the results that we've heard from 900 of our member organizations certainly put a lot of things into perspective. 47% of the organizations that responded to that survey indicated that they had already had to lay off staff as a result of reductions in revenue as a result of the COVID-19 epidemic. 61% of those same organizations have had to close at least one of their programs. And as a result, should we start? Can we start again?
We can edit if you just want to start your sentence where you left off.
That's what I wanted to check. Thanks. And nearly 93% had to reduce their operations in some way. As a result of those various reductions that I discussed, organizations have had to cancel, reschedule, or turn away 30% of their existing patients. Now that's very concerning, both in terms of the health of the organizations that we represent, and most importantly, for the health and welfare of the patients served by those organizations. Now, I know those fiscal realities, we have a number of ways that we're trying to address those, but it's equally as true that our member organizations have gone to extraordinary efforts to maintain contact with clients, to make sure that they're safe psychologically, physically, emotionally. And I want to talk a little bit about that. And, you know, it's really remarkable to me the kinds of changes, the kinds of investments that these organizations have made, when at the same time, 62% of the organizations who responded to that survey indicated that they only had enough cash to survive for 3 months. But what I've heard from more than one of our member CEOs, that the cash is there to support their communities, and that is what they're dedicated to doing. Certainly one of the most critical unanticipated expenses that so many of our members have encountered is this need for personal protective equipment. We've all become familiar with this term PPE. I will admit 3 months ago, I had no idea what PPE is or was. But now we're in the PPE business. Just a few weeks ago, we secured 2.3 million surgical masks and have distributed them to over 1,000 organizations around the country, so that these organizations could continue to meet patients where they are, in the streets, in their treatment organizations, and make sure that vital care is delivered. And the other expense that our members did not anticipate this year was purchasing laptops, cell phones, data plans, hotspots, because as the nation has pivoted to telehealth, one of the things that was really important is that both staff and clients actually have the materials needed in order to make those connections happen. So in addition to being in the PPE business, the other thing that the National Council has been doing over the last few weeks is setting up a COVID-19 relief fund. And through this fund, we've been so fortunate to secure a variety of donations, both in-kind donations in terms of access to online tools or services, supports for organizations as they try to deliver care remotely, as well as donations of hardware like laptops, which we've been able to distribute to organizations. And lastly, cash donations, which we're so grateful for. We're able to make very small grants to organizations to help them sustain their operations and stay connected to their communities. And the response that we've received from our members to these kinds of investments has been really overwhelming. We're so grateful to our members who continue to demonstrate incredible creativity in delivering care, and to all who have donated to this important relief fund. So I just want to talk a little bit about, kind of what are some of the other things that we're seeing out there and ways that we're trying to respond to the current situation. I've already mentioned that all of us, right, have had our lives severely disrupted. And this is certainly true for people with serious mental illness and addiction disorders, many of whom already exist on the margins of society. One of the sad realities of having serious mental illness in this country is that you're driven into poverty as a condition of receiving Social Security, Medicare, and Medicaid. You are forced to live on the edges of society. And certainly during this time of social isolation, economic uncertainty, issues related to social determinants of health have never been more important. And again, this is another area that I am so impressed. So many of our members have exhibited extreme creativity. I mentioned earlier that many programs have been closed. Many of those would be like day programs or partial hospitalization, where you have large numbers of people congregating for many hours at a time as a way to receive treatment or supports. So it's been so heartening to see that our organizations, in a way to respond to that, because many of these programs would also provide food as a course of treatment during the course of treatment. And so now organizations are in the food delivery business, making sure that food insecurity is not one more hurdle that people have to deal with during this unprecedented time. Organizations are also doing mobile injection clinics, setting up crisis stabilization units outside, having ways to engage people in terribly creative ways. Now, that's the way that organizations are responding to patients that have been in long-term care. But it's also true that this pandemic is creating all kinds of uncertainty. 1/3 of Americans are showing signs of clinical anxiety or depression. For every 100 American adults, 34 show symptoms of anxiety, depression, or both. And this is data that's coming from the US Census that was reported just this week in the Washington Post. 20 have symptoms of both anxiety and depressive disorders, 10 show symptoms of anxiety alone, and 4% show symptoms of depression alone. So we know that this is an unprecedented time. The Census Bureau data illustrates the scope and scale of the psychological toll exacted by the coronavirus pandemic. But we've seen these signs for months. The United Nations has warned of a global mental health epidemic as a result of COVID. And another poll released by the Kaiser Family Foundation on May 19th reports that more than 50% of all adults in the US say the pandemic has a negative impact on their mental health. Another indicator that we think is very troubling is that online alcohol sales increased by 243% the week of March 21st. Uh, and we know that alcohol has always been the most prevalent substance of abuse, exacting a toll much more significant than the opioid epidemic in terms of morbidity and mortality in the United States. And we're very concerned that this spike in alcohol sales will have tremendous downstream effects in terms of people needing intervention for substance use. We also saw earlier this year that SAMHSA reported that telephone calls to its disaster distress hotline increased 891% from March 2019 to March 2020. In no uncertain terms, America is on the verge of another health crisis, a behavioral health crisis. That's what the head of SAMHSA, Dr. Eleanor McCants-Katz, said during a recent White House cabinet meeting. Just last week, she said, if we ignore the reality of the enormous mental health strain we've put on our citizens, she's saddened but certain that the next public health crisis of our time will be that of mental health and substance use disorders. So, how do we respond to this need? Congress has been working overtime on a number of pieces of legislation to address COVID-19 and then the novel coronavirus. Unfortunately, of the trillions of dollars that have been allocated for response, very few of those dollars have been dedicated specifically to addressing the mental health and substance use needs of citizens. And this is at the same time that many members of Congress, the president, state legislators, mayors are all talking about the need to invest in mental health. But the National Council, we're not just going to sit around and talk about it. We're going to try to do something. So earlier, just a few weeks ago, the National Council, working in conjunction with 40 other mental health and addiction organizations, sent a request to Congress for $38.5 billion. And whatever the next legislative vehicle is addressing coronavirus, but these $38.5 million need to be addressed to strengthening and shoring up our nation's mental health and addiction treatment system, a system that has been neglected for too many years, has been plagued by underinvestment and lack of attention. And we can't, the numbers I just talked about the growing levels of anxiety, depression, and potential substance use will lead to more need for care in this country. And we've already have a system that's not capable of doing everything it needs to do now. It in no way can do more without additional investment. So that is what we're working on. We know that many of you share this concern. And for those of you who share this concern but haven't done it yet, you can go to the National Council website and reach out to your members of Congress, indicating your support for this request, and urging them to put their mouth, to actually act on something that they're talking about. Okay. Now this has been an unprecedented time, and there's another aspect of what's been going on that I wanted to make sure that we talked about a little bit. Now, I've been involved in the mental health field for many years. I have my little COVID scruff going on. Now, I usually don't allow myself to have a beard because it's all gray. That's how long I've been in this industry. And sometimes people will talk about mental health and substance use as reluctant or resistant to change. But what has happened over the last few weeks has been nothing short of remarkable. An industry that had very little use of telehealth in the span of weeks had to turn and make telehealth the predominant way of delivering care. Now, this was certainly facilitated by the incredible actions taken at the federal and state level to reduce some of the ridiculous regulatory and payment restrictions that had existed for many years. In March, we had more change in the terms of kind of the policy, regulatory, and payment structure for telehealth. We had more change in the span of 2 weeks than we had in the previous 20 years. And certainly the National Council has spent a lot of time in those early days trying to catalog, understand, and share the kind of changes that were occurring to make sure that people could have access to vital care in their communities. Now, that change, making sure that states actually took full advantage of the flexibilities that the federal government was presenting to them, was not only important for people who needed care, but obviously for the organizations that deliver that care, because people just weren't coming in to receive in-person care anymore. And that's why it was so important. So now CMS and the DEA are getting out of their own way and allowing incredible flexibility that is reaping incredible benefits. We're seeing now behavioral health organizations across the country, staff at every level, able to provide a wide variety of care using telehealth, both audio, video, in addition to just audio, the use of remote patient monitoring, other kinds of treatment supports that we think we've thought for a long time that these were important. They're important now, and they will be important in the future. And so one of the things what we're very concerned about is that the way telehealth have extended a lifeline to people fighting mental illness, substance use disorders, and isolation, that we need to make sure that these changes are sustained in some way. Because one of the interesting things that's happened over the last few weeks is not only have organizations have had to get used to delivering care in a new way, and they certainly have, but also consumers have had to adjust to this, and not just adjust to it, but to some extent begin to develop an affinity for care in this way. Now, I know, I think we've all learned you can order anything online. You have access to your bank account, to stores of every kind, restaurants, etc. Why shouldn't we have access to mental health and addiction care when, where, and how we need it? We need to make sure that the parts of these flexibilities are continued, the parts that make sense. And so we're going to continue to work on that. Obviously, there are other concerns that we need to figure out as a nation. Our broadband access continues to be spotty, especially in rural parts of the country. For many low-income persons, access to sufficient bandwidth or minutes on their phone plans, while some of those rules have been expanded temporarily as part of the response to COVID, we need to address that long-term to make sure that this kind of care is still available. We know that telehealth, tele-access to care is going to be important into the future. It keeps barriers to care low, it increases convenience, and it improves patient health. Now, one of the funniest things I've heard over the last few weeks is certainly the other thing that we have seen in the implementation of telehealth across the country is our no-show problem isn't what it used to be, right? Because people are just a phone call away. So we need to work collaboratively to make sure that we maintain appropriate flexibilities in terms of telehealth regulation, payment, but we also need to pay some attention as an industry to best care. We need to be thinking about what is this going to mean over time? What services actually need to be done in person versus what can be done online? And what's the right dose or kind of relationship between in-person care and remote care? How do we maintain fidelity to evidence-based practice? How do we do proper engagement for individuals going forward? Those are going to be some of the things we'll need to figure out, but we need to make sure that we still have the regulatory payment atmosphere to make that happen. All right. So our current reality, this coronavirus pandemic represents the single greatest threat to our health that we have seen in our lifetimes. It also represents an opportunity to shed light on the next threat, the threat to our behavioral health and the looming mental health and addiction crisis spreading across the United States. Suicide has been a perennial issue in this country. Opioid addiction has been a huge problem. The coronavirus pandemic will do nothing to tamp those down. It actually has the very real chance of making both of those worse. So we need to work together to change the delivery of behavioral health care in this country before it's too late. We need adequate investment, and we must remind everyone that without mental health, there is no health. Thank you for your participation in this conference, for your interest in this topic, and I hope that we can continue to work together to make our nation strong and healthy. Thank you.